Rick Doan, Executive Director of Interfaith Social Services. It has been an emotional roller coaster this year. My heart goes out to people who have lost loved ones in the midst of this pandemic. Many of our lives have been inconvenienced, but due to this public health emergency, we see people here at Interfaith every day whose lives have been upended. Today, thousands of residents are being fed, they're receiving mental health counseling, they're keeping their housing because of Interfaith's programs. You know, this pandemic, it's created so much disruption, but we get to see here at Interfaith the best of our society. And that's what I want to share with you today. As many of you know, volunteers are integral to Interfaith's programs. They are the heart and soul of our organization. At the start of this pandemic, when vulnerable populations couldn't come in, because they were asked to stay at home, more than half of our regular volunteers were no longer able to continue serving. We witnessed a miracle. The community rallied. We had so many new volunteers come in and help us because we were unsure in those first days if the pantry and some of our other programs would be able to continue running at the same capacity, and we have. So that miracle and our volunteers is what this video is about. They are our superheroes. They jumped right in to serve our neighbors in need, and they're the reason that we are able to continue feeding and helping so many people. So that's what this video is about. You can watch it now.
There are currently 772 cases of coronavirus confirmed in Quincy. There have been 70 deaths.
We went from probably a month and a half ago from 6 or 8 active cases, then we shot up to about 40 or 50 active cases.
This isn't going to be over tomorrow, next week, or next month.
Right.
This is going to take some time.
Now, Quincy has had 2,000 cases of coronavirus since the outbreak of the pandemic, and there have been 137 deaths.
In pre-pandemic days, I was here in the pantry filling the orders for clients and delivering them to the clients out in the waiting room. Post-pandemic, my job is to go out to the cars and register the clients.
I started volunteering here in April when COVID first hit. I feel healthy and able to help, and I thought those are the kind of folks that really have to step up right now. So,
well, it started as once a week, but they have had a lot of need lately. So for the last several weeks, it's been twice, sometimes 3 times, helping out.
And a great majority of the people who come here are working families that are paying their rent, they're paying their car payment, they're paying their daycare, and there's nothing left for food.
Over the last several months, there is a palpable increase in urgency and desperation, and it is very real.
Some of the folks that I meet when I go out to the cars, they start to tear up because they're so grateful for the work that we do.
As a youth, I was always taught by my mom and dad that your giving of your time costs nothing. So, and I had always incorporated that in my life. I had just finished chemo treatments for breast cancer, and it kind of put a new perspective on let's get back into that giving back mode.
I think people have thought, you know, we're only going to be in this for a few months, things will get better, but for many it has not gotten better, and they're just grateful to be back here, that we're here for them every month.
I'm lucky enough to have the stability that I can choose to spend my time volunteering. And truthfully, there are a million things we cannot do for each other. I cannot cure a person of COVID. I can't even protect them from COVID, really. But I can feed them, and that's something.